is Professor Mudhura Macharia. I am the co-founder of Nairobi ENT Clinic. I spend most of my time at the clinic and teaching at the University of Nairobi. And during my free time, I usually travel up country and I keep a few cows. Head and neck cancer are abnormal growths in the head and neck region. The cancer means that the growth is multiplies much faster than normal tissue. And when we have growths in the head and neck region, there are those that we'll call benign. Benign means that these ones, one, they grow slowly. Two, they normally don't spread to other parts of the body. While cancer will grow fast, will therefore have effects on the tissue surrounding it, and many times the cancer will spread to other parts of the body. A patient should look out for changes either in their appearance or in their function in the region of the head and neck cancer. The symptoms will depend on the region of the head and neck that the cancer grows. One of the commonest cancers is cancer of the throat and cancer of the voice box. If, for example, a patient is having blockage in the nose, which persists, is associated with blood-stained discharge and doesn't respond to standard treatment for either allergies or colds, then that patient should be evaluated for head and neck cancer. When swallowing becomes difficult and it is progressive, and again it is persistent, there's need for evaluation. When the voice changes and persists, we say that hoarseness of voice that persists for more than 2 weeks should be evaluated. When there is cough, and the cough sometimes is productive of a blood-stained sputum, one should be evaluated for head and neck cancer. If you find a lump anywhere on the head and neck region, again, it is good to have an evaluation, and especially if that lump persists for longer than 2 to 4 weeks and does not respond to standard treatment, say for infections. Diagnosis of head and neck cancer is based on history, the changes in various functions, any changes in appearance, and examination by a specialist. And the examination will involve general examination of the body, examination of the ears, examination of the nose, examination of the throat, and examination of the neck. After the examination, then the specialist will decide which specific tests will need to be done. The commonest tests are usually radiological tests, that is either X-rays, ultrasound, CT scans, or MRI. Then there may be blood tests that will be necessary. And finally, a biopsy, which is a small piece of tissue taken from the area where there is a swelling, will be taken and taken to the laboratory. Screenings for head and neck cancer are not painful. Like I said, some of them will be radiological investigations, which are non-invasive. And this will include various types of X-rays, CT scans, MRI, ultrasounds. There are times when we need to take a needle aspirate, as a needle is introduced into the swelling, and a small specimen is taken with a needle. And then there are also what we call incisional biopsies. A biopsy is taken. Biopsies can be taken either under local anesthetic or general anesthetic. And there may also be blood tests used as screening tests. The treatment of head and neck cancer depends on the specific type of cancer. There are 3 main modalities of treatment, that is surgery, radiotherapy, and chemotherapy. For some cancers, the 3 types could be combined for treatment. In other modalities of cancer, the various combinations, sometimes surgery followed by radiotherapy or surgery followed by chemotherapy, or chemotherapy and radiotherapy. Unfortunately, we don't know all the causes of head and neck cancer. Therefore, there are various cancers that we don't have specific preventative measures. But there are certain risk factors that have been associated with the head and neck cancer. Smoking is one of the most important risk factors for head and neck cancer, especially cancer of the voice box. More than 90% of people with cancer of the voice box have history of smoking. Therefore, avoidance of smoking is one of the major preventive measures. A combination of alcohol and smoking also is known to increase the risk of head and neck cancer. Therefore, avoidance of alcohol also. Recently, there are certain types of virus, the human papilloma virus, which also causes cervical cancer, has been known to increase the risk for certain types of head and neck cancer. Human papilloma virus in head and neck cancer is associated mainly with certain sexual habits, especially oral sex, and therefore avoidance of oral sex would also reduce certain types of head and neck cancer. Also, it is hoped that the vaccines that have been developed for human papilloma virus, which are currently being used for cervical cancer, will be used also for prevention of head and neck cancers that are associated with human papilloma virus.
My name is I've been having problems with my sleeping patterns. I didn't know that I had this particular problem until when I came to ENT. Before that, I used to wake up in the morning very tired and very groggy. It took almost the whole morning to get me, to get to the level, to my peak performing level every day. So I thought there's something, I knew that then there's something wrong. So I came to the ENT and they were really helpful. They were really professional. We did several studies. I think I did 2 studies. I remember the first one was the sleep study, where they hooked me up with some almost sci-fi looking gadget called a sleep study monitor, which basically monitors my sleep, my oxygen level, and all that. So I did that study, and when the results came out, it was really shocking, because the doctor told me like I stopped breathing like about 20 times in a single night, and I had a condition called sleep apnea. So there was which basically meant that during my sleep there's obstruction in my airway when I sleep. It's causing the obstruction, so causing me to stop breathing in the middle of the night, and so my brain sort of like wakes me up every time. So imagine doing that for 20 times, your brain doing that 20 times to you. Yeah, so that's why I've been waking up so tired and groggy in the morning. So the second study they did, so now they found the problem, so they needed to know like where exactly the problem was coming from. So they did an endoscopy, which was they put me under and put sort of like a camera inside my nose, down my airway, to see where the obstruction is. And yes, they did find the obstruction where the problem was. Yeah, so I went for surgery. After recovery, I can tell you, and this is a fact, I've never been more I'm even, people are even saying that I'm a different person every day, because I was just those people who shout at matatus in the morning because I was so tired every day going to work. But even my productivity has gone up. I sleep very well, wake up very early. Yeah, so the guys at ENT really did an amazing job. And I don't know, as in, if you ask me the one thing this year that I'm grateful for, is coming into ENT.
My name is Professor Mudhura Macharia. I am the co-founder of Nairobi ENT Clinic. I spend most of my time at the clinic and teaching at the University of Nairobi. And during my free time, I usually travel up country, and I keep a few cows. Well, obstructive sleep apnea is a state during sleep at which time somebody is not able to get in air into their system, while snoring is a noise that is made during sleep due to vibration of soft tissue within the airway. The symptoms of sleep apnea: 1 is snoring, noisy breathing during sleep. 2 is disrupted sleep, where somebody wakes up from time to time due to complete blockage, and many times somebody will wake up like they are drowning and they are fighting for air. First is to take a very good history, then examine the patient to determine the structures, the state of the structures that are in their way. Then after that are investigations. One of the commonest investigations that we do is to do a CT scan of the region of the nose and the airway. Then there's an overnight monitoring of sleep patterns. We call that sleep study. This can be done at home or can be done in a sleep laboratory. Currently, we don't have a sleep laboratory in Nairobi, but we hope to start one very soon. Then we put the patient to sleep for a few minutes, about 10 to 20 minutes, and we put in an endoscopy through the nose. Through this endoscope, an endoscope through the nose. Through this endoscope, we are able to examine the nose, the back of the nose, the throat, the back of the tongue, and below the tongue where air goes into the airway. This helps us to determine at what level is the obstruction occurring. Sleep apnea and snoring can be prevented by adopting a healthy lifestyle. Majority of people with sleep apnea will have weight problems, or obesity is one of the commonest causes of sleep apnea. Therefore, exercise and weight loss and eating well are very important preventive measures for sleep apnea and snoring. Sleep study involves monitoring of sleep throughout the night or while you are asleep. It involves a machine that is connected to various parts of the body. The machine has electrodes that pick up heart rate, pick up blood pressure, pick up noise coming from the airway when you are asleep. So it picks up the number of times you're snoring. And the sleep study usually the patient would be shown how to fit the machine at the time of going to sleep. And most times it doesn't interfere with your sleep. Of course, sometimes people do get conscious about it, but once you sleep, it is on, and it can run for about 12 hours. And it evaluates the sleep during the time that all the parameters that I've talked about have been picked up. So once the patient goes with the machine, it brings it to the clinic the following day, and the data is downloaded into the computer, and we are able to read and interpret the findings. Well, the effects of sleep apnea are related to the fact that a person with sleep apnea will have disrupted sleep, so they don't have a continuous sleep, and therefore they don't rest during the night. And most of the effects are related the following day, that the activity level is usually reduced. Many people will feel fatigued during the day. Sometimes they feel they don't want to wake up in the morning. You may have headaches because of lack of enough sleep, and then lack of concentration. It has been proven that people with sleep apnea have slow reactive times, and various studies have also shown that there are lots of accidents that are caused because of people dozing on the wheel since they didn't have enough sleep. In addition, during the day, there are people who sleep even sometimes when talking or when they are not doing anything. In addition to these effects, sleep apnea can also affect certain metabolic activities of the body. It can affect the heart, in which case people with sleep apnea are more likely to get high blood pressure. They are also more likely to get heart attacks. They are also more likely to get diabetes because lack of sleep interferes with the metabolism of sugar.
I am consultant and founder of Nairobi ENT and Throat Clinic. My favorite pastime is listening to music. A voice disorder is any disorder that affects the clarity with which you speak, meaning anything that will affect the breath that you use when you're speaking, anything that will affect the vocal folds movement when you are speaking, or anything that affects the resonance of that sound as it goes through your mouth, your sinuses. Because as you may know, the voice depends on not only the mouth moving, but the action at the voice box, the power from your lungs. So anything that affects these that will affect the clarity of your voice. Voice disorders are really diagnosed, first of all, from the history that the patient will give you. The history will tell you a lot about the changes that have occurred in a certain individual's voice, because they will tell you whether the voice is raspy, they'll tell you whether the voice is weak, whether the voice fatigues, whether when they speak their voice their action causes their voice box to pain them. They'll also talk about things like, I have to keep on clearing my throat whenever I speak. One of them is a simple laryngeal mirror, which you use with just a simple headlight. And that is available to most people who practice ear, nose, and throat surgery, to most doctors. The other way of looking at the voice box is using a laryngeal endoscope. And then feeding that endoscope with a special light, a stroboscopic light. And this procedure is called laryngostroboscopy. I think if anyone has an irritation in the throat that lasts for really beyond 2 weeks in terms of a hoarseness of voice, if you've been treated for a hoarseness of voice and you've had your treatment, and even after that treatment, 2 weeks go by without you really seeing that your normal voice has recovered, that is an indication that you need to seek the opinion of your doctor, and most recommended is that you see an ear, nose, and throat specialist. Well, a child can actually be born with a voice disorder. This is due to a congenital problem of the vocal folds. Things that can be seen at this age are things like laryngeal webs or laryngeal cysts, which the child is born with, or laryngeal clefts. But as the child gets older, actually the commonest reason for a child to get a hoarse voice is going to be an infection, inflammation, or bacterial infections. But voice abuse is also possible in this age group, and children who scream or who shout a lot can develop something called screamer's nodules or vocal nodules. And these are actually lesions that can resolve once the child stops the habit of screaming or shouting. The commonest voice disorder that we all get is going to be a laryngitis, and a laryngitis usually is due to a viral infection or a bacterial infection, and usually associated with a cold or a cough. Once this resolves, generally speaking, you're going to get your normal voice back. But the commonest cause of voice problems we find in the patients we see here is vocal abuse, meaning you overuse your vocal folds, either because you are in a profession where you're often using your vocal folds, or and that would be teachers, singers, politicians, or that type of a person, call center employees, or you're just a mom at home and one day you just screamed as your child and you can get a vocal fold lesion. So vocal abuse is the next thing that one often sees here. There are different treatments available for voice problems, and it all depends on what voice problem you actually have. But voice rest is maybe the most frequently used form of treatment, because if you have a very bad sore throat, a very bad cold, the best thing you can do to fix your hoarseness of voice is to rest your voice. Secondly, plenty of hydration, so voice hygiene, hydration, resting your voice, avoiding irritating environments like smoke or smoking yourself. All these things are going to help your vocal fold to heal. Then teaching you voice habits, that are correct. And usually this is to do with breathing, which is taught to you by the speech and language therapists. So you're taught how to breathe, how to relax, so that when you actually use your voice, you're not straining.
I'm Dr. Samuel Nyaga, ENT surgeon, ENT specialist at Nairobi ENT clinic. Sinuses basically are spaces that you get around the nose, and everybody has sinuses. So there's no disease called sinuses. So now these sinuses being spaces, what normally happens, we have sinuses up here, which we call the frontal sinuses. We have other sinuses around this area. There are other sinuses just here, just next to the eyes, and there are others behind here. They're just air containing spaces which come out or which connect to the nose. Basically, we know that everybody has sinuses, and even most other animals have sinuses, but we really don't know the exact function or the exact purposes of the sinuses. Broadly, there are two major causes of sinusitis. There's what we call allergic sinusitis, and there's what we call non-allergic sinusitis. Now, I'll first talk about allergic sinusitis, and we all know that there are some people who suffer from allergies. And basically, when you say somebody has allergies or somebody is allergic to a certain substance, it means that this person is hypersensitive to that substance. And I'll give an example. We can go to a flower plantation, and if somebody is allergic, for example, to pollen from the flowers there, he's going to suffer from a lot of sneezing, a lot of irritation, a lot of itching, and the nose will block. Immediately they get exposed to the pollen. And in fact, when they go home, the blockage, the running nose will persist. Then most of us might not be affected if we're not allergic to that pollen. Now, once the nose is blocked, then it means there's no good flow of air into the sinuses, and also there's no proper drainage of fluid from the sinuses, and therefore you get the inflammation occurring in the sinuses, and you get mucus accumulating in the sinuses. The other common cause, as I said, is non-allergic, and in non-allergic we have things like viruses, bacteria, and fungus that can cause sinusitis. Basically, when it comes to the diagnosis of sinusitis, you do not need any tests to make a diagnosis. There are two main features of sinusitis. That is a blocked nose or a running nose. One of these symptoms must be there before we say that somebody has got sinusitis. Now, the other symptoms that patients have include things like headaches, and this kind of headaches, the patient will say the headaches are usually around this area of the face and the eyes, or even on the side, because as we have said, you get the sinuses around this region. So the patient is going to have a headache, and normally it's a dull headache or more of a congestion. And the patient might say, in fact, sometimes these headaches are much more severe in the morning when I'm waking up, but as the day goes by, the headaches become less. One is what I call lifestyle modifications or non-medical treatment. Then from there we can go to medical treatment, and finally we can look at the surgical treatment. Now, for the lifestyle modifications or the non-pharmaceutical treatment, if somebody is prone to allergies, then the most logical thing to do is to try to control the allergens. The allergens are those things that cause the allergies. I'll give an example. Majority of people are most people are allergic to house dust mites. These are small insects that live in the dust you get in the houses, and therefore dusting the bedroom, dusting all those surfaces whereby dust can gather, avoiding using blankets and instead using cotton sheets and duvets, it helps control the house dust mites, and therefore this one may make the patient not to develop the sinusitis. Treating sinusitis is quite a protracted affair. It's a long-term affair. For example, if somebody is allergic, he has some allergies, we know that even if we treated you today, we are not curing the allergies. So this is a patient who is likely to keep on coming to see us. And the safest medicine for these people to use, as I have said earlier, are the nasal sprays. And for the nasal sprays, they are absolutely safe. So somebody can use them for 2, 3, 4, 5, 6 months without worried about any side effects. What I normally do is this. Sometimes, if you know what the patient is allergic to, there's some people who tell you during the cold season, that's when my sinuses start misbehaving. So you can put this patient on the spray for only that time, and when the weather changes, then you can stop and follow up the patient. Again, if the symptoms appear, you can restart the patient on the treatment. In the management of sinusitis, surgery is considered only when optimal medical treatment fails, not at any other time. Now, at what point do we say that optimal medical treatment has failed? We say that if the patient has been on treatment for up to 3 months and the symptoms are not disappearing, or you put the patient on treatment but the symptoms keep on getting worse. There are 2 or 3 surgeries that we do to patients with the sinus disease. The commonest surgery we do is what we call endoscopic sinus surgery. And in endoscopic sinus surgery, what basically we do, because people are afraid, they ask you, are you going to cut my nose? Am I going to have marks on my face? And in endoscopic sinus surgery, what we do not cut the patient. So no scars, no marks on the face. We normally use what we call telescopes. These are small tubes that have cameras and they're connected to a video monitor. And we are able now to see the nose, and it is magnified, and we're able to see the structures so well. We are also able to identify the opening of the sinuses that could be blocked, open them up to create proper ventilation into the sinuses, and also to make the sinuses drain well. Because we said if the sinuses are not draining and if the sinuses are not being ventilated very well, that's the time now you get the mucus and the inflammation occurring in the sinuses. So endoscopic sinus surgery is what we do here, and that is what is done in the rest of the world. And it is the ultimate in the management of sinus surgery. The other form of surgery that could be done, especially in children, is what we call sinus washout. in sinus washout, this is a patient who has got a lot of mucus or pus in the sinuses, and basically what we do is to open the sinus at one point and wash out all that mucus or that pus that could be there in the sinuses. Recovery after sinus surgery, it will take a maximum of 2 weeks. So in 2 weeks' time, the patient will be able to go to the hospital, be able to go back to work, or the patient can go back to school. During the recovery period, I think what is very critical to note is that once we admit the patient for surgery, the patient stays in the hospital for at least 2 days. And why this happens is because after the surgery, there are some materials we put in the nose. We call them nasal packs. And these are to absorb the blood and other secretions that are coming from the operated sinuses. So you stay with those packs for 48 hours. Then after we remove them, we are able to discharge you to go home, probably on the following day. Now, when you go home again, we know this nose has just been operated on, or the sinuses have just been operated on. So we expect some oozing, some mucus accumulating. And therefore, when the patient goes home, we are able to teach the patient how to clean their nose, or what we call douching. They are able to use saline to clear all those debris, the clots that could be forming, and this actually, it hastens the process of healing. I'm Dr. Samuel Nyaga, ENT surgeon, ENT specialist at Nairobi ENT clinic. And what I do for fun, I like to play golf and I do bird watching. Tonsils and adenoids are what we call lymphoid tissues. And lymphoid tissues are tissues in the body that help the body fight infections. And everybody or every child has got adenoids, and all people, they've got tonsils. When you talk about adenoids and tonsils, there are basically two conditions that affect them. The first one is infections. For example, you can have tonsils or adenoids that just get sick, they get inflamed. And once they get inflamed, for example, the tonsils, the patient is going to have fevers, the patient is going to have pain, headaches, general body aches, joint pains, difficulty in eating, or pain on swallowing. That is because the tonsils, they are infected. The other disease or the other condition that can affect them is enlargement. They can just become big, but they're not inflamed or they're not sick. And therefore, in such cases, the patient does not have pain or fevers, but what the patient, and especially a child in this instance, what the child will present with is what we call upper airway obstruction. And what are the symptoms of upper airway obstruction? Usually you'll see this child probably between the age of 2 years and 4 years who comes with snoring. The mother will tell you this baby has been snoring for the last very many months. The child is going to have mouth breathing. The mother will tell you again, this child has got an obstructed nose or a blocked nose. The child has got poor sleeping. This is a child who keeps on tossing in bed. You place the child in bed. This minute the child is facing one side, the next minute the child is facing the other side. The child keeps on turning and tossing and waking up very many times, what we call having frequent arousals, because the child is not getting enough air during sleep. Sometimes there's not much you can do, because when you talk about infections in children, you start getting these infections when the child starts going to school. And that's why we see parents who tell us from the time this child was born to the time this child began going to school, this child has never gotten sick. But now once they start going to school, every day they've got, there's so many kids in school, so they start getting infections from each other. And these are the kind of infections in the upper respiratory tract that will make the adenoids to be large, or these are the kind of infections again that will affect the tonsils and get what we call tonsillitis. When it comes to treatment of these diseases, I'll start first with the infections. If you have infections in the tonsils, what we basically call tonsillitis, and you examine the patient has got infected tonsils, the patient has got fevers, pain on swallowing, or difficulty in swallowing, joint pains, the symptoms we talked about earlier, then the most important thing, one, is to make the patient comfortable, and that calls for the use of painkiller medicines. The painkillers, apart from sorting out the pain, they also reduce the fevers, and therefore the patient will be much more comfortable, and the patient will be able to drink or even to eat. Again, this is the role of antibiotics. There are many antibiotics that we use, and the choice will depend with the doctor, or if the patient has got no allergies, there are many medicines, there's so many antibiotics we can use. What is most important and what I want to stress on is that the moment we start you on an antibiotic, if it's a 5-day course, please make sure you finish the antibiotic. Finish the 5 days. If it's a 7-day course, just finish the 7 days. Sometimes we see with some patients, the patient will take the antibiotics for 2-3 days, and once they start feeling better, they stop taking the medicine. Now, what this does is that the bacteria gets exposed to suboptimal treatment, and it just gets suppressed, and it develops resistance to that antibiotic, such that next time, probably you get the same infection, the same antibiotic will not be able to work. Before we talk about why surgery is important in the management of adenoid and tonsillar diseases, I think it's important for everybody to know that for most of the diseases we come across, surgery usually is the last option. And therefore surgery will be indicated where medical treatment fails. And just to go back, when we get a patient with recurrent tonsillitis, we'll give this patient antibiotics, painkillers, but you cannot keep on treating this patient 3, 4, 5, 6, 7, 8, 9 times in 1 year. And this patient, maybe as a child, they're missing school, or the parents are missing work. So you cannot keep these children on treatment forever and ever. So when medical treatment fails, then we say surgery is indicated. Therefore, for enlarged adenoids and tonsils, usually we might put the patient on some nasal medicines. Those are some drops that we put through the nose plus some antihistamines for a week or 2 and see how the patient responds. If the snoring stops and the blockage disappears, then we just follow up the child. Again, for tonsillitis, it's normal. If you get 1 tonsillitis in a year, that is good. If you get 2, that is fine. If you get 3, it is still fine. But the moment you start getting more than 4 infections in 1 year, then that's the time we say we need to do surgery. When we talk about adenotonsillar diseases, most of the patients we're operating are the children. I think the most important thing is to inform the parents or the guardian that this child needs surgery, and we tell the parents about the risks of the surgery and also the outcome of the disease if surgery is not undertaken. Now, the common complications you would get in surgery for adenoids and tonsils is bleeding and also pain. So we always tell the guardians that this child is going to have some pain, and therefore we'll put the child on some painkillers. And then we tell the guardian or the parents that this child may have some bleeding. And if this occurs, then you're supposed to call the doctor or come back to the hospital. Again, these 2 complications are extremely rare in kids. However, in adults, pain can be a significant problem. Once we're in theater, when it comes to removing the adenoids and the tonsils, we don't cut you anywhere. We remove them through the mouth. Therefore, you should not worry about getting scars on your face or on your neck. The procedure, like removing adenoids, can take about 15 minutes. Removing tonsils can also take about 15-20 minutes. Removing both can take about 30 minutes. Therefore, when you give us your child to operate, again, you should not expect that within 30 minutes we'll call you to come and get back your child, because the moment we get to theater, there are all those preparations we go through. We'll prepare Then we do the actual surgery, and by the time we are calling you to come and get your child from theater, then the child is fully awake. So all of this process can take about an hour to 1.5 hours. Postoperative care is very important. When it comes to postoperative, I think it's good for the parents to know that within 2 hours of coming out of theater, the child is able to eat. What we do recommend is for the child to be given soft, sweet, cold stuff, and therefore what we recommend the child to be given first are things like ice cream. The child can take yogurt, milkshake, can take apple juice, and within 5-6 hours, the child can take their dinner or they can take their lunch. And these would include soft mashed foods like mashed potatoes. Child can take minced meat. The child can even take fruits such as watermelons. Child can take scrambled eggs, sausages. They can even dip the bread in tea, and they are able to take the bread. So feeding is important, and what we know is that the earlier the patient starts eating after surgery, the lesser the pain that is going to follow, even when the child goes home.
I'm an ENT specialist at the Nairobi ENT clinic with a special interest in facial, plastic and cosmetic surgery. Aesthetic medicine is a new subspecialty in medicine, and it has a lot of scientific research in it. And the main aim of aesthetic medicine is to satisfy the patient's needs in terms of their appearances. Broad range of conditions. We treat from aging, the aging phase, and in the aging phase we want to address wrinkles and sagging skin. Acne patients are also treated with some procedures in aesthetic medicine. People with scars, traumatic scars, people who have hyperpigmented skin. The hyperpigmentation can be either as a result of post-pregnancy or drugs that have resulted in uneven skin. People who have dry skin. People who generally want to just add an oomph to how they look. Most of the treatment is in-office treatment because we try and do either non-invasive or minimally invasive treatment. And the treatment can be as basic as a chemical peel or to microdermabrasion, to extensive treatments such as Pelvic, Botox or filler injections, and mini facelifts which can be done in the office. For instance, if you have a broken nose and you don't like the shape of the nose, then we have rhinoplasty, which in basic terms is just a nose job. We have facial treatments for scars. If the scar is stretchable, then we can reduce the scar either by doing a microdermabrasion or a chemical peel. If in terms of accidents you get a facial palsy whereby the face is not symmetrical, we can inject botulinum toxin in the unaffected area to bring symmetry into your face. Patients who've had accidents that involve the ear, we can do reconstructive surgery to the ear, reconstructive surgery to the nose, to the mouth, to the eye region, just to bring back the symmetry. It depends on the type of treatment you want. Most of the treatments require you to give a consent, so in our case you have to be over 18 to give a consent. If you have skin conditions like acne and you came as an adolescent, we will not do aggressive treatments like a chemical peel because there are still hormonal changes, and all we would offer you is medical treatments to treat the acne. It depends on what you want. If we start from the top, if we start from the lips, most people will come because they want lip augmentation, they want a fuller lip like Angelina Jolie. So that you can get young ladies come in even the night they want to go out, and instantly the results are instant. If it is wrinkles, when we inject the botulinum toxin in the areas where the wrinkles are, you start noticing the effects from the third day, but maximal effects is after 2 weeks. For people who want to increase more volume in the face, we would inject fillers in the facial regions. Those you can see the results instantly. For chemical peels and Peleve, which are facial rejuvenation techniques, you see the results instantly. So if you're going even for a function like a wedding, you can come the day before, a bride can come the day before and do Peleve treatment, and she will have the glowing skin that she desires on her wedding day. Treatments like acne, the results are not instantly. We ask you to be patient. At least within 6 weeks, you will start noticing changes if you have acne skin. Botox gained popularity after World War II, and what we do with Botox, once we inject the area with wrinkles, it stops the compound that is secreted by the body to cause wrinkling. But then the compound it's just a temporary stop. So after 4 to 6 months, then the effect of the Botox wears off. So you require a touch-up every 4 to 6 months. You don't have to wait for the 4 months. You can come even at 3.5 months, so that you don't have that break. People don't notice that today you had wrinkles, 2 weeks later you don't have wrinkles. You just want something, to blend in, so that, because most people wouldn't want others knowing that they are doing this treatment. So come in, have a couple of weeks before the 4 months